So if I can ask Rose to come up and talk about MDA and, settlement actually, and then of course the role of MDA.
Hello, and thank you, Zainal. Zainal's also a worker at MDA, so he represents us well. So I guess I was asked today to come and talk a little bit about settlement services in Queensland and Australia, and a little bit more about MDA and what we do currently in Brisbane. I'm not going to talk as much to the health aspect because I'm not the expert in that field, but I can talk around the things that help clients access those health services and what we do to support that. A little bit about MDA. We're funded through the Department of Social Services to deliver services through what's called the Humanitarian Settlement Services. So this program works initially with families from offshore who've arrived for the first 6 to 12 months, depending on the family's need. Most families do exit our program at 6 months, but it depends on the assessment of what's going on in the family. Obviously, a Somali family of 8 may be taking longer in the program than possibly Zainal's family, who are quite educated and arrived already settled nearly. So, but just to note as well, I'm giving background in terms of settlement services. They will change in the near future. So there is a slight shift, but there's the basis of settlement in Australia still is about the same. So under this program, we're funded to deliver foundational settlement services. So the aim of the program is to support the individual and the family to develop their capacity and understanding of Australian laws and systems, to ensure that they are linked to a GP, English classes, employment providers, schools, counselling, social support, so faith groups or cultural community. So initially we get the referral from the Department of Social Services, and what we do is we do what's called a pre-arrival assessment. So we review the health manifest that we receive from the department. We review the family composition, where they've come from, demographics. So in this particular family's case, we note that they're a Somalian family who've been in Kenya for 10 years in a refugee camp. So already we're making assumptions and assessment in our heads about what things potentially this family will need on arrival. When we see a Somalian family, most of the case managers are wondering whether the wife is pregnant, because it's quite a cultural and common thing for a lot of our Somali families when they're young, and we notice there's young children still, that mum potentially is pregnant or will be pregnant shortly. So we are thinking of that on arrival with the airport, with lots of experience of women showing up pregnant. So from that point, we pick them up from the airport. We greet them on arrival at the airport and take them to their short-term accommodation. So it's a reception accommodation. Sometimes that house becomes their long-term house. Sometimes it's just a holding house until they find an appropriate house within a settlement space. So from that point, the family is conducted an area orientation. So they're shown the local shops, where the chemist, the pharmacy is, where the local bank is, public transport in the area. If they need to get to the church or the mosque quickly, showing them where they can access that, asking if they want to be linked to their cultural community, and giving them the numbers or sharing their numbers with that community if they've consented. We then take them within 3 days to Centrelink. Centrelink also help with the bank account, the Medicare number, the tax file number. We then also are looking at English classes, school enrolments. So there's a lot of things happening within these first few weeks of arrival. They're also meeting with case managers. So from within 1 week of arrival, a case manager within my team will meet with the family. We do what's called a psychosocial assessment. So this assessment can take anywhere between 2 hours to 4 hours, depending on the family size and composition, but also depending on how much they're willing to disclose at that point. We do what's very similar to the nursing and family assessment that's done at that time. So it's actually a good thing that that's being revisited at the nursing assessment as well, because families have just arrived. It's contractual that we have to do that assessment within 1 week, but families may not be ready to talk at that time. So we work very closely with Refugee Health Connect to share information when the client consents, to be able to put that picture together where it's appropriate. In that assessment, we're looking at many things. We're looking at the settlement and personal life skills, and what are the factors that may contribute, and what things we may need to focus on for that family to build those foundations. So what are their their financial literacy skills. Do they know how to use an ATM? Do they know to use a mobile phone, computers? Generally, when they first arrive, we're checking, do you know how to turn on the stove? Do you know how to use a light switch? We're doing a full assessment constantly within that first week, so we know what services and supports we can put in place for that family. Some families learn very quickly, some families will take a long time. So that we've known families from various backgrounds, especially ones from refugee camps, to take a long time to learn these life skills. So we are providing that education and support, but we also rely on the community, like Zainul said, and other services such as GPs and nurses to continue that education. So if you're seeing a really good example of that, I was at a doctor's appointment with a client who asked me to come along. She'd forgotten she was sick and quite unwell and couldn't get out of bed on the weekend, and said to the doctor, I was really sick, but I couldn't call you because you weren't working. Straight away, the doctor stopped what she was doing and just provided education on emergency services and 136 and made sure the client understood. And it was a perfect example of supporting that settlement journey, understanding that the client at that time may not have had those skills to do that. That client had been here for a year, but she just had very low life skills and learned helplessness from being in a refugee camp for 20 years. So from there, we're also assessing their social and community. So their ethnic background is very important. From a Somalian family in this example, the ethnic groups are quite varied. In Brisbane, we normally have 2 or 3 major ethnic groups of Somalian background. There is one ethnic group called Marihan. There's 2 different communities of Marihan in Brisbane, and they don't talk. So we have to do a very thorough assessment around who they feel comfortable talking to and things like that. So it's very important to do that assessment straight up so we can actually identify who is an appropriate social support for that family. We also do what's called a general health assessment and just checking the family, what are their health goals and aspirations. We're not looking to tell the doctor what they need to do, but we need to check with the family and make sure they're feeling comfortable to approach the doctor about that health issue. We also are assessing mental health, so asking them if they've had any experiences back home that they want to talk about or they're finding troubling them, talking about coping strategies and capacity and making those assessments already. Also looking at employment. We also do a family history, childcare, education, all that stuff. We also do an assessment on the youth specifically as well. We also assist families to go to a health assessment. So we work very closely with Refugee Health Connect to identify appropriate doctors to be able to do a health assessment for families and link them to that doctor for long-term care. Case managers are supporting families to attend those appointments at the first thing. So at MDA, we book cultural support workers who teach the family how to get to that doctor's surgery. Once they arrive, they are teaching them how to go to the admin desk and say that they're there for their appointment, helping fill out the forms, and making sure the family understands for next time how to get there. As I said before, we're looking at building capacity and building independence. We're not wanting to build dependence on our service. We want to encourage them to do things independently. We do what's called the life skills orientation. So we do provide a 3-day training with every family member that various stakeholders attend that can provide education on refugee health stuff, legal systems in Australia, employment services, how to get a job, how to not swim between the flags. There's a whole very big program that they go through, and throughout settlement we're assessing and making sure that they understand those key pillars of that orientation program before we exit them. So we look at what's called the settlement compass in our framework. So we're looking at the 4 key pillars of quality of life, independence, belonging and well-being. So the client is in the centre of that and directing that service. So we're setting the foundations in our program to achieve that in settlement. So that could take 5 years, it could take 20 years. It just depends on the families. It's a very subjective thing. So quality of life could be around income, housing and health. So someone may want to buy a house or just rent a house or get Department of Housing. So it's really up to the client's goals in that. Well-being could be around safety, acculturation, resilience, independence around English, education, employment, and making sure that they're linked and able to access services independently. And belonging is around community connection, civic participation, and citizenship, and just cultural competence. Knowing to, when you say bring a plate to a barbecue, that means bring a plate of food. Things like that. So yeah. Just trying to think. In terms, can I just quickly touch on the Somali case? I'm sorry, I wrote it all down. I just wanted to mention, in terms of this Somalian case, I think it's really important, I think, to note that with the TB, that's actually quite a stigma in that culture. So in terms of confidentiality with interpreters, when I sought cultural advice from one of our Somali cultural guides, that was one of her key points to me. She was wanting me to make sure that was said. So the family, not just the husband, but the whole family would be feeling that stigma. And so that's really important to acknowledge in terms of confidentiality with interpreters. You can actually request interstate interpreters, so I would recommend utilising that, but also making sure that that you understand what ethnic group they're from. The ethnic group and the dialect in Somali is very different. She was giving me an example of dialects where she was saying room in her dialect. The client was saying something else as the room. So something as simply as a room is a very different word in that language. So really important to understand that. In terms of the mother, cross-culturally, we would be getting an urgent GP appointment for her. She arrives 30 weeks pregnant. We're not going to wait until the health assessment. We would be getting her straight into a doctor's surgery to get referred to antenatal care. Postnatally, culturally, the mother would be waiting 40 days at home. That 12-year-old daughter would most likely be caring for the children, cooking and cleaning. That is something that we have to work with the family on to help them understand, obviously, legal requirements of attending school, requirements of all that, but also identifying other community supports in that space. So it really depends on the client's and family's needs in terms of how we can provide support, but the main goal is to not help them, but to give them the skills to do that independently. What we're not is the after-hours contact or the babysitting service or the family friend that can pick them up, things like that. So, or even giving legal advice. We're really just linking them to those services. I'll stop.
Thank you, Rose.